He loves football. He likes running, being mischievous with his brothers. He likes getting into trouble sometimes, like most little boys do. But he's basically a very happy-go-lucky kid. We were in Tallahassee. It happened so quickly. We had just gotten there, really. And all of a sudden I heard him screaming and holding his hand, and there was a lot of blood.
Benjamin's injury was mainly to his right hand. He had reached into a fan, a sort of a barrel fan that was being used to blow up a bounce house. And in reaching into the fan, the blades of the fan basically sheared off the skin and subcutaneous tissue on the top of his hand from about his wrist to the knuckles, the first set of knuckles in his hand.
It was all so surreal. They gave me stuff to try to stop the bleeding. I picked him up and rushed out with him because they were calling an ambulance. During that time, a police officer got there and was asking me questions, and finally the ambulance got there. And Benjamin was crying and screaming, but he kept insisting on uncovering his hand because he wanted to see it. And we could see his tendons, we could see everything. It was horrible. All I could think of was, I need to get him to a hospital because I know at the hospital they can fix it. Once a doctor sees it, I had this hope that everything could be fixed. So that's all I was thinking. We couldn't get there fast enough. And we rushed to, I guess it was Tallahassee Memorial there, by Tallahassee. And the doctor couldn't make it. I mean, this happened around 11 o'clock in the morning, and they couldn't get a specialist there to see him until about 5 o'clock that afternoon.
Benjamin was transferred to the emergency department at the University of Florida through the system of referrals in the state of Florida, because we had an expert in hand surgery, myself, on call and available at the Shands for this particular type of injury or any hand injuries that might occur during that time period.
When we got there, immediately there were people there to help us. They put in an IV, they started giving him the medicines he needed, and the doctor was telling us what the first surgery was going to be and what they were going to do. So it was very fast.
Right then and there we start the process of approaching the injury, trying to manage the wound, the patient's pain and anxiety.
I just felt that he could fix it. I felt that whatever accident had happened to Benjamin, that because Dr. Richards was a hand specialist and he's seen so many worse injuries, that he could, be the one to take care of it and make everything better for him. And that's all I wanted. I wanted Benjamin to be the way he was just a few hours before.
It required several steps to get the appropriate coverage of pliable, soft skin to help him use his hand after the injury had healed. So this procedure or process took several weeks to complete and ultimately provided him with a durable skin covering. It's soft and pliable. His ability to move his hand, or his range of motion in his hand, has recovered almost to normal, and he continues to recover at this point and do extremely well with his hand, using it as much as he would normally have used it prior to his injury.
Benjamin writes, Benjamin plays with Legos, football, he does everything that he did before, and he's not inhibited by it. He wears a special compression garment, which he's going to wear probably for a couple more months. We're blessed that we were able to find Shands and Dr. Richards.